Marijuana is legal and widely accepted here in Michigan, and many use it regularly.
But health experts warn failing to disclose cannabis use to your doctor could seriously impact your safety, especially during surgery.
13 on your side's Alexis Dumergine joins us now to explain how marijuana could affect anesthesia and your recovery. Alexis.
Julia and Elena, it may not be something people think of, but as more people use cannabis, doctors are seeing surprising complications during surgery. As cannabis use becomes more mainstream, there's a growing concern inside operating rooms.
When you have cannabis within your system, whether it's smoking, vaping, edibles, stays in your system for quite some time.
For patients heading into surgery, there's already a lot to think about, but doctors say one increasingly common habit is flying under the radar: cannabis use.
This can lead to prolonged and sometimes unpredictable effects. They also are metabolized by the same enzymes that many of our anesthesia drugs are metabolized by.
Cannabis can increase a patient's tolerance to anesthesia, meaning doctors may need a higher dosage to keep them sedated. It can also raise your heart rate, affect blood pressure, and make post-op pain harder to manage.
That is either going to require higher doses of the induction agents, so the agents that put you to sleep. You could have an increased airway activity,
which then can lead to
a laryngeal spasm or a bronchospasm. Two different things, but basically a narrowing of your airways and making it very, very difficult for us to oxygenate and ventilate you.
Experts say the solution is simple: honesty. Patients should be upfront about any cannabis use, daily, occasional, or edible, even if it's legal.
We are not there to judge you or to place some type of stigma upon you. We really, truly are just trying to make the best plan of care. So, when they ask you, do you use marijuana? How often? When was your last dose? How do you use it? As I said, smoking, vaping, edibles, be honest and open. So
experts couldn't stress enough the importance of being honest with your healthcare providers about cannabis use. However, they also recommend refraining from use for at least 10 days prior to any scheduled surgical procedures. In the newsroom, Alexis Dumergine, 13 on your side.